I was struck this morning listening to the eloquence of the Taoiseach when he talked about the 445 very unfortunate people who've lost their lives now, that they weren't just statistics, they were people who were loved and cared for. And I totally agree, and our sympathy goes out to them, their families and their loved ones and friends. But I think there is a gap between the words and the reality. On the 12th of March, I attended a HSE briefing with you, and I asked the Chief Medical Officer if we were testing people who care for the elderly in our community. And you remember the answer? We don't do that. No reason why, just we don't do that. And I was shocked by the answer, but I am still shocked by it. But I also think that now we have reached the stage where you have the head of HICWA, Mary Dunyan, saying that speedier testing will be of benefit. And she said we're all learning. But I want to say to you, Minister, what slow learners we were not to have recognised at that point that the most vulnerable cohort in society has experienced globally are the elderly, remain the elderly, and we were not testing those who care for them. So I want to ask you, on the question of the testing for the care workers of the elderly, are they now being tested? And indeed, are those elderly people who are moving from a hospital situation into a care home situation being tested? Because I believe that both of those things were not happening, and that has led to the spread of clusters in the care homes that we are now seeing emerging as a national emergency. The impression is given, of course, that the 25,000 plus citizens of this country who are in private nursing homes are somehow not the responsibility of the state or the HSE. That is definitely out there. But it's an impression that comes from a disjointed and a fragmented system, which you've just admitted you want to see ended, that the care of the elderly, how it's done in this state, has to change. But it didn't happen by accident. These were political decisions taken by Fianna Fáil and Fine Gael in previous regimes. Indeed, when Micheál Martin was Minister for Health, his regime showered, in fact, developers with massive tax breaks in order to get them to invest in care homes, private care homes. It was done under Charlie McCreevy's rule as the Minister for Finance at the time. Look it up. And it was then and since then that the number of care homes in private hands mushroomed in this country. So one lesson we do have to learn is to move away from that system, and to hear the testimony of those who are working in that system now. On RTE this morning, on Facebook, on other social media, it is heartbreaking and shocking that in this country, a first world country in the 21st century, we are living in the dark ages when it comes to the care that we're given for the elderly. So there is a fear out there, and I'm not expressing it just for myself, but there is a fear out there, and lots of people contact me, that somehow there's an unwritten or deliberate policy to keep the elderly out of the hospitals. And when the Taoiseach earlier said that by now we would have expected our ICU to be full to capacity, and it's not, it's far from it, perhaps that's because we are not sending those who may need ICU care from nursing homes into hospital settings. I'd like you to address that question because I think it is very, very serious. We need assurance that there's no guidance or no hidden rule that we don't take people from care homes into hospitals, but instead we deal with them there. And in the case of Maryborough, you were reassured that 2 consultants were involved, but you haven't said how they were involved. Did they actually see the patients? Were they there physically in presence? Or was it done by some kind of teleconferencing, some discussion over the internet through Zoom or other means, that the decision was taken not to move them into more acute care? I think those questions need to be answered. I also want to note that Professor Jack Lambert of The Matter has said today that the situation in the nursing homes is a catastrophe in the making and it's a national emergency. Could you respond to that statement, and will you tell us how the state, the emergency team, will respond to that statement if they agree with him? Now, I understand that staff are being shifted, and staff, particularly agency staff, are being asked to go to these care homes. There was lists of something like 50 in the Leinster region that urgently need staff that was published last night by certain agencies that employ nurses. But the problem is that many of those staff move from home to home, and we're still not testing them. So we're still in danger of creating more and more clusters and more problems. Dr. Myra Cullinan, the Dublin coroner, has said that she is concerned that not all COVID-19 deaths are being reported according to law, whether proven or suspected. I'd like to ask you to comment on that and to tell us if you share her concern. And just a question I've been asked to ask you is there proposals, or are there proposals to change regulations for those who are allowed to fill in death certs when a death occurs? I'm all in favour of hazard payments for workers, for all workers, particularly health workers. I'm all in favour for all frontline workers. But could we start protecting them? Could we start testing them and protecting them as a starters, whether they're bus workers, shop workers or health workers, because we're not doing that. The Taoiseach said at the highest level he's doing his best to convince the companies who produce reagent. He's asking them, he's imploring them, he's encouraging, and he's failing. At this point, and you have emergency legislation, would you instruct those companies to make demand reach the need, to make the supply reach the need for the demand, because it isn't happening fast enough? The final question I have for you is on student nurses in placement. Are you now paying student nurses who are in placement as against those who are volunteering?
Well, thanks very much. So first thing I'm going to do is not make any partisan political comments, because I used to be an awful partisan politician, and really this pandemic teaches you that everybody in this House in all parties and none are working their very best to save lives, and that's been my experience of engagement with people here. I think we're very lucky to have Dr. Tony Holohan as the Chief Medical Officer in our country, a public health specialist. And when he answered your question on the 12th of March, of course he answered it entirely correctly as a clinical expert, and I'd rather he made the decisions than politicians, and I think the public would too. And he pointed out that the case definition in relation to the World Health Organization that's being applied here is that you're testing people when they have 2 symptoms or more. So if they work with fever, and I think it's a fever and a respiratory condition, so when you work with that definition, if you're somebody working with an older person and you have the symptoms, of course you get tested. But the definition at the moment doesn't allow for asymptomatic testing. Now, in fairness, the point you're raising is a legitimate one, which is, as we broaden the testing, should we be trying to test more people, particularly people coming into contact with vulnerable people, and particularly vulnerable people? And the shorthand answer to that is yes, but that broadening of the case definition will be decided by clinicians at the National Public Health Emergency Team, rather than by me or respectfully on the floor of this House. But I do expect the case definition to be broadened next week, in line with the comments I was making to Deputy Shortall. 100% agree with you on the idea that we cannot allow a viewpoint to in any way fester that somebody who's in a private nursing home is not our responsibility. They're a citizen of this country. There are particular risks to this virus. This is a virus that we can't beat and stop in every circumstance, but we can do everything humanly possible to protect as many lives as possible, and we won't be found wanting in that regard. And I know people working in HIQA, the HSE, public health, healthcare staff, nursing home staff, they won't be found wanting either. I do need to make the point from a reassurance point of view. 70% or thereabouts of our nursing homes, according to HIQA today, are still COVID-free, or certainly don't have significant outbreaks of COVID. 30% do. So you deploy different strategies for those ones. For the 30% who do, you try to mitigate, you try to help, you try to support. And for the 70% who don't, you try to keep them COVID-free. And I think that's where some of the comments I was making recently about trying to test asymptomatic people, provide isolation facilities where appropriate for staff or for patients, beef up your staffing through the redeployment agreement with the unions who've been super, are some of the ways you achieve that. I'm glad you brought up the hospitalisation of older people, because it gives me a chance, which I think is what you want, for me to put on the record of this House the clarity in that regard. So these are clinical decisions. We have empty beds. We have loads of empty beds. We've never had so many empty beds in the Irish Health Service. We have ICU capacity. The health service is open for patients, and there is no bar in terms of your age or in terms of a disability, as I've heard in recent days. They're clinical decisions made in nursing homes. The principle of right care at the right place at the right time applies. And I do need to, I'm not going to get into the individual case, but it's about individual clinical reviews deciding, is a hospital transfer appropriate or not? It's about talking to the resident, talking to the citizen, what their wish is, talking to the family, deciding whether they want palliative care. They may have advanced care planning in place too. But these are clinical decisions. I want to say that to you. They should not be made by anybody who's not a clinician. And I think we see the person in charge regulations in relation to our nursing homes makes that clear, that it should be a person with clinical training. But let people not be worried or fearful in that regard. If you're an older person and it's appropriate, I accept that. If you're an older person and you need to go to hospital, you should absolutely be brought to hospital. but be conscious many families are having these discussions and individuals too. Final point on the coroner. I very much welcome the fact that the coroner wrote that letter, because we want to find as many cases as possible. This isn't an idea of trying to, suppress numbers. The more of this virus we can find, and sadly the more fatalities we can find, the more we know about it and the more we can deal with it. I'm satisfied that we're reporting an awful lot more in this country than other jurisdictions, but we need to continue to strive to do absolutely as best we can. And I do note from my memory that the coroner did also say that she detected a very high level of reporting. But I think she's right and proper to be vigilant in discharging of her duties.
Thank you, Minister. Deputy Berry, on behalf